Hey folks, it's Dr. Gerstmar from Aspire Natural Health. I wanted to talk to you today about maybe the single most important distinction that you need to know about, whether that's in health or whether that's in any other area of your life. And it's simply this: the difference between knowing and doing. Knowing and doing. Now, I know most people are going to go, well, yeah, that's obvious. But the reality is, I can think of many times in my life that I've gotten confused between knowing and doing. And the reality is, we see on a fairly regular basis that people who come to see us as patients or as clients, they get it confused as well. So, the old saying goes, knowledge is power. Is that true? Let's pick it apart, okay? So certainly, without knowledge, we run into a lot of issues, right? My son was watching the Angry Birds movie a few days ago, and I caught a little piece of it where the Angry Birds are climbing a mountain, and it's the usual montage of them, grinding and pushing and getting into a lot of trouble, but slowly and painfully making their way up the mountain. They get to the top of the mountain, there's a big cheer, and everybody's happy, and then they look and realize they just climbed the wrong mountain, right? And so the most important piece of knowledge is A, knowing what to do, and B, knowing what not to do. Because when it comes to health or fitness or any of these fields, we see a lot of people wasting a lot of time and money and energy doing the wrong thing. So listen, doing without knowing is a waste of time. You waste your time, you waste your energy, you waste your money, and at best, you're going to get somewhere nice that you don't really want to be. And at worst, which is what we see happen a lot, is you end up just going in circles, not really getting anywhere. So if you're not even going to know, it's best not to bother doing anything about it. But where we see the issue, and I think all of us can think to times when we've all done this plenty of times, is just knowing something is not the same thing as doing something. So is knowledge power? The answer is kind of. But really, applied knowledge or doing, intelligent doing, that is real power. Because look, most of us, at least in general terms, know what we need to do to lose weight or get healthy again, right? A lot of it, at least the basic stuff, is not a secret. Is there anyone out there who knows that they should stop smoking, right? I have not run into anyone in all my years who has come to me and said, "What? Smoking is harmful?" It's not that they don't know. At the end of the day, it's that they don't do. And I don't want to put that down in any way. There's addiction, there are other issues. So doing is not always easy, and that's why often we don't do it. Where this comes into play is that we see a lot of people come into the practice wanting more knowledge. And there's nothing wrong with knowledge. The conventional system right now runs on patients with low knowledge, right? You go in and the doctor says do this and you say great and you go away and do it. When we ask people, did they explain to you why you were doing this or what this was? Were your results explained to you so you understand what's going on in your body? 90% of the time, patients come back and say, no, I don't know really what I'm taking or why I'm taking it, what it is, or truly what's going on in my body, unless that person has taken it on themselves to educate themselves further. And I think that's tremendously helpful. If you understand that your symptom is caused by this and this is what's going on, and the treatment that you're doing is aimed at addressing this in this way, you don't have to know the biochemistry or the physiology or in depth, but if you at least understand, oh, I'm eating this or I'm not eating that, I'm taking this or I'm avoiding that, whatever it is, and this is the reason, that can tremendously help with step 2 here, which is actually doing. So in the medical field, this is called compliance, which is, in other words, is you come to the doctor and I tell you what to do. Compliance is you actually doing it. And we know traditionally that compliance is very low. A lot of people just don't do what they've been asked to do, which has led the conventional system by and large to say things like diet and lifestyle don't matter because when you ask people to make changes, they just don't do it anyways. So why bother with that and just go right to the drugs? Now, we know that's not true, but we also know that diet and lifestyle changes are challenging. And we're not going to get into that in this session. We talked about it before, and we'll talk about it again. But the point here is understanding that knowledge is important. If you don't know what mountain to climb, it doesn't matter. You'll just waste your time. But just knowing what mountain to climb doesn't mean that you'll actually do it. So in our practice, we see this often. We're blessed to work with very intelligent people, often people who've done a tremendous amount of research, who've essentially become experts in what's going on for them, and that is awesome. But many of them come looking for that extra little piece. Oh, if I just knew this next piece of information, that would unlock everything, and then I could solve my health problems. And occasionally, again, that's true. But what we find most of the time is these people have plenty of information. They may not just be applying it correctly. And that isn't getting into, well, you're doing it wrong, because sometimes that's true. Sometimes we know we need to stop eating donuts and we need to get outside and get some exercise or go to bed earlier or take the darn things that we're supposed to be taking, and we're not doing it. And so certainly that's a matter of not doing what we know we need to do. All of us in our lives are guilty of that. But it can also be that the information hasn't been put together and implemented into a plan, and that plan hasn't been worked to get the results for people, and we see that commonly. So I've begun using health coaches in my practice. After years of struggling with the frustration of low compliance, people not doing the things they need to do to get better, my focus is not just on educating people, but it's actually getting them moving forward and taking action. A lot of our patients, at least a lot of people who approach us, let me rephrase that, not patients, but a lot of people who approach us about working together are often confused. What's this health coach business? Why do I need to see a health coach? I already know many of these things, right? And that's where we talk about the difference between knowing and doing. I understand that you know many of these things, but first of all, do you know the right things? You may believe you do, and you might, but you might not. And secondly, just because you know these things doesn't mean that you're doing them at all, or B, that you're doing them correctly, or C, it's within a context of those things that are really working properly for you. And that's where the coach is really integral. And since implementing health coaches into my practice, I've definitely seen the results skyrocket for people. So I know it's different and it's strange, but at the end of the day, it's not just about what you know, it's about what you do. And health coaches can help you do better so people get better results. All right? So whether you use a health coach or not, it's important that you focus, that you have to stop the learning at some point. And I don't mean all learning, but in other words, you need to find out what you need to do to fix your problem, whatever that is, and then you need to begin implementing and not just get stuck at gathering more information, because that leads us to information paralysis, or what's also called paralysis by analysis. You just keep gathering more information and gathering more information, and we see that a lot of times. Well, could it be histamine, or could it be SIBO, or could it be fungal infections, or could it be parasites, or could it be X, Y, Z, A, B, C, all the way down the list? At some point, we have to gather enough information, implement a plan, assess the results of the plan, and then we may need to go back and learn more information because we've missed pieces or the plan isn't correct. But it's not just learn. All right, folks, I hope this is helpful. We know that health coaches are the way of the future, and they're the way for people to get better results. So if your doctor is not making use of a health coach, please contact us. We can help you. At Aspire Natural Health, we are experts at treating gut dysfunctions, autoimmune diseases, and other hard-to-treat cases. We don't give up on our patients, and we're always striving to know more, learn more, but also to do better by our patients. All right? If you're interested or someone you know is interested, we offer a complimentary 15-minute phone consult. Whoever it is, you and I can get on the phone. We can talk about it. We can find if we're a good fit, if we feel we can help you, if we're an approach that you want to take, and if so, we can get started. All right, folks, knowing versus doing. Knowing is important. Doing is even more important. Until next time, take care.